When you get your blood pressure checked, you get two numbers. You might hear the doctor say something like 120/80. The top number, that's called systolic, measures the pressure in your arteries when your heart beats. The bottom number, diastolic, is the pressure when your heart rests between beats. Usually when someone has high blood pressure, both numbers go up. But sometimes only the bottom number is high. That's what we call isolated diastolic hypertension. So what's isolated diastolic hypertension all about? Basically, it's high blood pressure where only the bottom number, the diastolic, is high. That means your diastolic is 80 or above, but your top number, the systolic, stays under 130. Doctors and heart experts, including the American Heart Association and the American College of Cardiology, actually recognize this as a distinct type of high blood pressure. You might be wondering, how common is this? Well, it actually affects about 6 out of every 100 people in the United States. And here's something interesting. If you look only at people who already have high blood pressure, about 1 in 5 of them have this specific type, isolated diastolic hypertension. You'll usually see it more often in people under 55. Why? Pretty simple. As we get older, the diastolic number, the bottom number, tends to go down, while the systolic number, the top number, slowly creeps up. So this pattern is much more common earlier in adulthood, before those age-related changes really kick in. Now, isolated diastolic hypertension usually isn't an immediate problem. But over time, it can raise your risk of heart and blood vessel issues. The good news is, your healthcare provider can help you manage it. Before we get to treatment, let's talk about the symptoms of isolated diastolic hypertension. The thing is, most people don't notice any symptoms. And that's true for most types of high blood pressure. But if your diastolic number climbs really high, say 120 or above, you might notice anxiety, a mild headache, nosebleeds, or shortness of breath. These same symptoms can also happen if your systolic number reaches 180 or higher. Sometimes you might not even realize that what you're feeling is linked to your blood pressure, unless you check it at home. That's why it's so important to let your healthcare provider know about any spikes or sudden changes in your numbers. Here's something really important. If your diastolic blood pressure reaches 120 or higher and you notice any of these symptoms, call 911 or your local emergency number immediately. These symptoms include chest pain or discomfort, confusion or trouble thinking clearly, dizziness, swelling, heart palpitations, peeing less than usual, seizures, severe headache, vision changes. This is what doctors call a hypertensive emergency. It means your blood pressure is dangerously high and could be harming your organs. Don't wait, get medical help right away. So how is isolated diastolic hypertension treated? First, it really depends on your age and other risk factors for heart disease. For many people, medication isn't needed right away. Instead, your doctor will usually focus on lifestyle changes that can help bring your blood pressure down. These include following a Mediterranean or DASH diet, maintaining a healthy weight, getting at least 150 minutes of aerobic exercise each week, quitting smoking, limiting or avoiding alcohol. You might need to start medication sooner if you have diabetes, chronic kidney disease, cardiovascular disease, or a high risk of cardiovascular disease in the next 10 years. Now, you might be wondering why this happens. The truth is, experts don't fully understand why your diastolic blood pressure can be high while your systolic stays normal. But research does point to a few major risk factors, like being overweight, having sleep apnea, or smoking. Even though isolated diastolic hypertension might not cause immediate problems, it does increase your risk of a heart attack or other heart issues later on. It can also raise the chances of dying from cardiovascular disease and increase the risk of congestive heart failure, especially for women and for people under 60. So even if you feel fine now, it's really important to keep an eye on your blood pressure, make healthy lifestyle choices, and stay in touch with your doctor. Being proactive now can make a big difference in protecting your heart down the road. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.